Okay, so this is going to be the review for the final exam for microbiology. And a couple of points. A lot of people have sent me emails asking what's the best way to study for the final exam. And my emails have been pretty consistent. You know, don't worry about going so much over the old material. And now when I say that, I mean, don't go back through Chapter 1 trying to read Chapter 1 or go back through Chapter 2 trying to read Chapter 2. I would study the new material. And what you don't understand in the new material, look it up in the previous chapters. So a lot of the information that you see in the new material was covered before. The way to look at the new material that we're going over, we're talking about the same microorganisms that we talked about all during the semester, except for we're relating those microorganisms to specific diseases now. So you can spend a lot of time going over the old material, but I don't think that's the best, utilization of your time, especially in this short period of time that you have to study for it. So your focus should be on the new material and then using the old material as a resource for you to look up any concepts that you don't understand. Now, just as I said for the other review sessions, do you have to know everything? Well, yeah, knowing everything helps you to understand all the concepts, but you absolutely positively have to know the information that I go over for this review to be able to do well on the final exam. And yes, it is comprehensive, but you already have studied that material, and the material you studied before we're using for the new material that we're going over right now. Okay? So that being said, I'll go over some of the key points that I think you need to know for the exam and also cover the material that I think you need to know for the lab exam. And then after that, if you have any questions, I'll be happy to go over any questions that you might have, okay? I think we start off with some of the skin infections. One of the things we talk about is a disease or an infection called herpes gladiatorium. Now, we've also talked about route of transmission before. So you should know what is meant by the term route of transmission, and then you should also know the route of transmissions for herpes gladiatorium. You should be able to describe the characteristics of several types of infection. Now, we've talked about the herpes simplex virus before, and we've actually also talked about some of the characteristics of that infection, so you certainly should know those characteristics. If you also remember, we talked about herpes simplex virus as a latent infection. You should also remember what we mean by the term latent infection. You should also know the characteristics of varicella zoster. You should know the characteristics of Streptococcus pyogenes. You should also know the characteristics of an infection that would be related to Staphylococcus aureus. And I think these are all gone over in the section or the chapter that talks about skin diseases or dermatological types of infections. You should also know the mode of transmission for chickenpox, smallpox, German measles, and cold sores. You should also know the characteristic presentation of rubella, smallpox, the mumps, and chickenpox. You should also be able to tell me the characteristics of skin infections that are related to scabies. I think you covered that much more so in the lab early on, but it's actually discussed in the dermatological infection chapter now, and will be covered on the exam as well. You should know what the cause is, what the organism is, and I won't say microorganism because you actually can see scabies with the naked eye. And then you should also know what the treatment is for scabies as well. There was another infectious infection called sporotrichosis. You should know how you can get this infection. You should know what the presenting signs and symptoms are and what the typical treatment is for it. Sporotrichosis. You should also know what the treatment for smallpox is. You should also know what infections are commonly related to the fungus Candida albicans or Candida albicans, however you want to pronounce that. And you should also know how this infection is typically treated. You should be able to describe the characteristics of the following types of skin disorders: carbuncle, furuncle, styes, and pimples. You should also know what organism is commonly related to those types of infections. You should also be able to describe to me the general characteristics of propionic bacterium acnes. You should also know how that is treated. Propionic bacterium acnes. How is that treated? You should also be able to compare and contrast the infections related to two viruses, the pox virus and the parvovirus. You should also know the relationship between these three infections: microsporum, epidermophyton, and trichophyton. There's a relationship between each of those microorganisms, and you should be able to identify that. You should know what's meant by the term bacteriocidal and bacteriostatic. Bacteriostatic and bactericidal. You should know the meanings of both of those terms. Now, you should also be able to identify the infectious organisms and signs and symptoms for the following: keratoconjunctivitis, pink eye, neonatal gonorrheal ophthalmia, trachoma, and, well, I say conjunctivitis. Conjunctivitis is basically the same thing as pink eye. You should also know, why is a newborn's eyes treated with antibiotics at the time of delivery? And you should also know an example of antibiotic agent that's used to treat the baby's eyes at the time of delivery. You should understand the difference between, I'm sorry, let me rephrase that. The treatment for a virus and bacteria are different. I'll use the example of the herpes virus and streptococcus. They are treated with different categories of drugs. You should explain to me why they are treated with different categories of drugs. You should be able to define the term reservoir. And specifically, what do I mean by a reservoir for a pathogen? And you should be able to give me some examples of reservoirs. For example, what would the reservoir for typhus be? Typhus, the plague, yellow fever, malaria. Each of these have a specific reservoir. You should be able to give me an example of that. We've talked about an organism that has a specific type of staining characteristic. We refer to that as acid-fast bacilli. You should be able to tell me what organism that commonly refers to. You should be able to characterize the infection Pneumocystis carinii pneumonia. Pneumocystis carinii pneumonia. When do you typically see it, and how is it treated? You should be able to compare and contrast the following viral infections: hepatitis A, hepatitis B, hepatitis C, and hepatitis D. Now, they each have a little bit different characteristics. They also have some similarities. You should be able to identify those characteristics of each. You should be able to briefly describe illnesses related to Reye syndrome. Should be able to briefly describe the characteristics of a person infected by pneumococcal meningitis. And I think later I ask you to compare and contrast different meningitis, and I'll wait until I get to that point. I don't want to get ahead of myself. You should be able to know what's meant by the term triggering of a latent infection. Triggering of a latent infection. So obviously you have to know what a latent infection is. You should be able to give me an example of that. You should be able to give me the causative agent of pseudomembranous colitis, the causative agent of pseudomembranous colitis. And then what factors contribute to a person developing pseudomembranous colitis? You should be able to give me the infectious agent. It's a specific bacteria that can cause peptic ulcer disease. You should be able to give me the causative agents or microorganisms that cause the diarrheal syndromes. And typically, what is the major reason why we see a high instance of diarrheal diseases? And we see this more so in developing countries, if that would be a hint for you. What's the major reason why we see a high instance of diarrheal diseases? You should be able to characterize the signs and symptoms of traveler's diarrhea. Again, I think you went over this in the lab in the previous exam, and it's gone over in the lecture portion of the course this time. And how is traveler's diarrhea treated? You should be able to characterize an infection related to aflatoxins. Characterize the presentation of the illness, and what are the signs and symptoms typically related to. You should be able to compare and contrast an endotoxin and an exotoxin. I know you've done that before in the previous chapters. You should be able to describe to me how the Clostridium botulinum toxin works. And again, we've talked about that before in previous chapters. You should be able to give me the causative agents for non-gonococcal urethritis, leptospirosis, and a chancroid. You should be able to characterize the signs and symptoms of pelvic inflammatory disease, which would include letting me know what types of microorganisms can contribute to the cause of that disease, pelvic inflammatory disease. You should also be able to compare and contrast urinary tract infections in men versus women. You should also be able to tell me what organisms most commonly are seen in urinary tract infections, and why specifically these organisms. What is typically the similarity between these microorganisms that lead them to cause urinary tract infections. You should be able to describe the presenting signs and symptoms of syphilis, both primary, secondary, and tertiary syphilis. Each of those forms of syphilis have a specific characteristic, and you should be able to identify that. You should be able to tell me how syphilis is diagnosed. I know we've gone over that in previous chapters. The microorganism group B streptococci. It can be very catastrophic for a fetus. You should be able to identify the potential outcomes of a newborn that's infected by this microorganism. You should be able to characterize the infectious organism, rabies virus. Should be able to describe the presenting signs and symptoms of a person that's infected by this virus. You should also be able to explain to me how the virus reaches the central nervous system from a peripheral location. You should also be able to compare meningococcal meningitis with pneumococcal meningitis. Meningococcal meningitis and pneumococcal meningitis. Biggest difference is going to be the infectious organisms. The signs and symptoms of the meningitis will be very similar. You should be able to give me the causative agent for the poliomyelitis. I said that wrong. The causative agent for poliomyelitis. And typically, how is it treated? You should also be able to give me the causative agent of tetanus. characterize the signs and symptoms of tetanus, what typically are those symptoms related to, and then how would it be treated. You should also be able to characterize the diseases related to the following: Trypanosoma brucei gambesi, the African sleeping sickness; Naegleria fowleri, which you studied in the lab on the last exam; and Listeria monocytogenes. Listeria monocytogenes. You should also be able to tell me what a prion is. You should also be able to give me an example of a disease that's caused by a prion. You should also be able to give me the responsibilities of the Center of Disease Control. What is this organization? What is its responsibilities? You should be able to tell me what a gram stain is. You should also be able to tell me the differences in the types of gram stains you can see. You should also be able to tell me what's meant by morphology. You should be able to tell me the morphology and the gram stain for the following: Streptococcus, Staphylococcus, Pseudomonas, Escherichia coli, Neisseria, and Spirochetes. You should be able to explain to me how vaccines are derived. You should be able to explain to me what is meant by the term mutagen. And you should also be able to tell me some different types of mutations that can occur. For example, the frame shift mutation, a spontaneous mutation, base pair mutation, nucleoside analog mutation. You should also be able to explain to me the effect of X-rays on microorganisms. How do these X-rays work? You should be able to compare and contrast ionizing radiation with non-ionizing radiation and give me examples of those. You should be able to compare and contrast encephalitis with meningitis. There's a subtle difference between the two. You should be able to give me an example of organisms that can cause either of those illnesses. And you should also be able to explain to me why those illnesses are so difficult to treat. Another concept that we've already discussed previously in other chapters is the concept of the endospore. You should be able to tell me what organisms have an endospore. You should also be able to tell me the laboratory procedure that helps you to identify the endospore. Now, there's a specific cell line referred to as eosinophils. Eosinophils. Eosinophils, when they're seen in high numbers, are indicative of a specific type of infection. Should be able to tell me the type of infection that we're dealing with. We've also discussed previously tuberculosis. We've also discussed the drugs that are used to treat tuberculosis, and you should be familiar with those. We've also talked about drugs that are used to treat cestode infections or helmet infections. You should be familiar with those. Why do those drugs work? And what other microorganisms can be treated with the medication that you would typically treat cestodes or helmets with? And why do these medications work? You should also be familiar with the term broad-spectrum antibiotic. We already discussed tetracycline is considered one of the broadest spectrums of antibiotic. You should be familiar with the mechanism of action. And you should be familiar with the various types of infections that could be treated with tetracycline. You should also be familiar with the term drug resistance. And you should also be familiar with why certain drugs, or why drug resistance occurs. Let me rephrase that. You should be familiar with the term drug resistance, and you should be able to explain to me why drug resistance occurs. You should also be able to tell me what drugs are typically used in treating fungal infections. You should also be able to tell me the effect of penicillin on certain bacteria, or on the bacteria that they're treating. What's the mechanism of action of penicillin? You should also be able to tell me what was the first antibiotic discovered, and you should also be able to tell me the source of most of the antibiotics that we use now for drug therapy. You should also be able to tell me the following. What is meant by the term innate immunity, naturally acquired active immunity, natural acquired passive immunity, artificially acquired active immunity, and artificially acquired passive immunity. Now, those are all of the specific topics or key points that you need to know for the lecture portion of the exam. Now, you absolutely positively have to know that information. Again, you can see, even though it's comprehensive, it covers material that we talked about in the previous chapters, but we relate those concepts directly with the information that you're going over in the new material. Okay? So let me just move quickly into the laboratory portion of the final exam, and then after I finish that, then you guys can ask me any questions that you might have. For the laboratory exam, it only covers the new material. Now, there are a few concepts in there that relate to the previous labs that you've had. But by and large, if you study just the new material and only use the previous material as a resource, you will cover the comprehensive portion of the exam. So you certainly should be able to characterize the avian influenza. And just as we've talked about for other forms of viruses, there are a lot of similarities in the avian influenza that we've studied previously. You should be able to tell me how avian influenza is spread. Now, for the next semester, I'm probably going to use the swine flu or swine influenza, but there are so many similarities between these types of influenza that it doesn't matter whether I'm talking about avian influenza or swine influenza or if we come up with another type of influenza. The pattern of that disease is going to be the same. And typically when we talk about influenza, there are some specific signs and symptoms that we typically see in humans that are related to influenza symptoms. Now, certainly based upon the virulence of the virus or the disease-causing capability of the virus, it will change or it may dictate the signs and symptoms that we see. But by and large, all symptoms that we see from influenza virus are going to be about the same. The severity may change. You should understand what the implications to human health are from any influenza, but specifically we're talking about the avian influenza. There are some treatment regimens that were considered for the avian flu. You should be familiar with those treatment regimens based upon antiviral therapy. You should understand the importance of treating the routine seasonal flu and also treating the avian flu. Now, I pause here and digress just for a moment because we treat the seasonal flu every year. But when a new strain of flu comes in, like the swine flu, for example, there's still an important reason why we treat the seasonal flu. Now, avian flu actually never infected humans on any wide scale. The avian flu was strictly limited to birds, and it was actually only limited to domestic birds. Now, the swine flu at one point only infected pigs, but there was a point where the swine flu was able to infect humans. So now why did that occur? Well, it occurs typically because the swine flu at some point was able to mutate, and most likely it mutated with the regular seasonal flu. Now, the reason why we didn't get avian flu is because humans don't have the receptors for certain types of viruses. That's why, for example, a dog can get distemper and we don't get distemper. That's why we get a common cold, but our dogs and our cats don't get the common cold, because they don't have the receptors for those specific types of viruses. Well, the same holds true for the avian flu, and it did hold true for the swine flu. The swine flu at some point only infected pigs, but at some point it had an opportunity to mate with or to mutate with the common seasonal flu, and in that mutation, that swine flu virus then picked up the appropriate surface antigens or the appropriate surface subtypes to be able to be picked up by the receptors on the human cell. Now, this never happened in any large scale with the avian flu, but you can see the importance now of treating the regular seasonal flu. If we kill the regular seasonal flu, we decrease the opportunity for the avian flu to mutate with the seasonal flu, so humans will never get that virus. So it's an important always to give that routine seasonal flu vaccine as well because of these strains of flu that come along. Now, another definition that you should also be able to understand and recognize is called herd immunity. Now, somewhere in the previous chapters, you studied herd immunity. And herd immunity is that immunity that the general population has that protects us from a common virus. The reason why in the healthcare industry, a developed country will be able to treat major diseases is because the majority of us do not get sick. The overwhelming majority of us, 70%, 80% of the population, already have the antibodies against the seasonal flu. It's that 20 to 30% of the population that will become sick from the seasonal flu, and the resources that we have in our healthcare industry are devoted to that small portion of the population, 20 to 30% of the people who get infected, because the rest of us already have herd immunity. Well, imagine when another strain of a virus or influenza comes along and we do not have herd immunity. This means that 70 to 80% of the population will get sick. And if 70 to 80% of the population is sick, that leaves us only with about 30% of the population who is not sick. We have to take care of the sick. And then we also quickly run out of resources. Now, a well-developed country like the United States can get over that okay. We will still have a significant morbidity and mortality. But imagine a developing country like Haiti is a perfect example. If Haiti got hit with the swine flu right now, we would see 60% of the population would probably die from the avian flu there, if the avian flu would be able to be contracted by humans, because there's not the resources to be able to deal with that. So it's very important to have herd immunity. So you should understand that definition. Now, you should also be able to summarize the events that occurred in the 1918 Spanish flu. And that very concept of herd immunity really seems largely in this type of a pandemic, because there was no herd immunity anywhere in the world. And so people who were in the western portion of the world traveled to the Far East, they traveled to Europe, and because there was no herd immunity, large segments of the population became sick and died. So you should be able to summarize those events that occurred in that flu. You should also be able to identify the populations in the age groups that were greatest impacted by this flu. And you'll see those age groups were based upon people's habits. You know, a younger population, 20 to 40, is able to congregate. People that congregate together are able to pass along viruses very easily. We sneeze, we cough, we breathe the same air. And so populations that congregate with a flu that has no herd immunity, that population of people are going to be impacted the greatest. And so you saw that with the Spanish flu, that the age group of 20 to 40 were the people that suffered greatest. Also healthcare professionals. So review that portion of your reading and understand how these certain groups, these certain age groups were impacted, which groups were infected, which groups actually did not seem to have a higher instance of the flu virus. You should also be able to explain how viruses are named based upon their surface antigen or their subtypes. And we use the two terms, hemagglutinin and neuraminidase. Remember, the human cells only have certain surface receptors for certain hemagglutinins and certain neuramidases, and this is how the flus are named. So you should be able to explain to me that concept. You should also be able to explain to me the community impact of a pandemic. Whether it's from avian flu or any other type of flu, there will be a community impact, and that will be consistent irregardless of what the infection is. You should know what's meant by the term influenza variant. You should also be able to explain to me why the typical surgical mask, which we see almost every year when seasonal flu hits, why the typical surgical mask serves no benefit whatsoever. Now, there is a type of mask that can be used, and you should be familiar with that type of mask. You should also be able to explain to me and I think I may have mentioned this before, explain to me the different types of drug therapy that are utilized in treating these influenza viruses, why we think these types of treatments would be effective, and then why we think these types of treatments may not be effective. Okay, we'll change our train of thought. There were some sexually transmitted diseases that your lab also went over. Should be able to tell me the main signs and symptoms of trichomonas infections in women and in men. Should be able to characterize the syphilis infection. You already know how syphilis is diagnosed. Make sure you know that. You should be able to tell me what the stages of syphilis are, primary, secondary, tertiary. I think we already went over that in the lecture portion of the course. You should be able to tell me what a chancre is, what the typical presenting signs and symptoms are. You should be able to give me the primary implications of a person with untreated syphilis. You should also be able to tell me what the treatment options are for syphilis. You should also be able to describe to me the organism Neisseria, the morphology and the gram stain, which we already talked about previously. You also should be able to characterize the infection related to Neisseria gonorrhea. And then you should also be able to characterize the virus, human papillomavirus. There are some prevalent virus strains that you should be familiar with, and there's also some physical characteristics or growths that are associated with human papillomavirus, and you should be familiar with those. And that basically covers all the material that will be on the final exam. And so I'll open it up for any questions that you may have on any of the things we talked about. Any questions? Everybody's hearing me okay, right? I hope.
I can hear you.
Mm-hmm.
Yes, okay. All right. Just making sure. Anything I need to repeat or?
The final, it's going to be held in room 2008, right?
Yeah, and I'll put an announcement up for it, right. It'll be in the computer lab. That's room 2008, College of Nursing, second floor. And I believe you have 3 times, 10 o'clock, 2 o'clock, no, 10 o'clock. Am I right? 10 o'clock, 2 o'clock, 4 o'clock, what is it? Somebody help me out.
I think the last one is at 6.
At 6, okay. So 10, 6, and 2, is that it?
Yeah. I think.
Okay, I think 2. I'm not sure. I'm not looking at it right now. I'll be there, though, so don't worry.
Do you know about...
I have a question. You said we should know the pox virus and
another virus to compare and contrast them, but I didn't catch the second virus.
I think I said parvovirus.
Would you spell that, please?
Yeah, Parvovirus.
Thank you.
You're welcome. Now, remember for the exam question. Go ahead.
Sorry? Oh, do you know about how many questions are going to be on it already?
Should be about 60 questions on the lecture, and 25 questions on the lab.
Okay.
I'll put that on the announcement, though.
Okay. And are you going to post this now? What we just went over?
I certainly will.
Okay, because I missed some parts, but I missed a good amount.
Oh, okay. Yeah, the recording will be posted right after we finish.
Okay.
Remember to bring your student ID. And if you're from another university, I know USF doesn't issue you a student ID, so then you'll have to bring your driver's license, okay? But you got to have a state-issued ID to come in.
Okay.
If you don't have your ID, I cannot let you sit for the exam, okay?
Okay.
Any other questions?
Mm-mm.
Going once. Going twice. Okay, good luck, you guys. I'll see you on Friday.
Thank you.
Thank
Thank
you.
you.
Okay, you're welcome. All right. Bye-bye.